We tend to put our dental health in its own little box, right? It's all about brushing, flossing, maybe the occasional filling. But what if I told you that your mouth is actually a window, giving you a really clear view into the health of your entire body? And that's the big question, isn't it? The idea that your gums could be connected to your heart, your hormones, or even your bones, well, that's a pretty huge shift in thinking for most of us. In this explainer, we're going to follow the evidence and see just how deep this connection really goes. So here's the plan. We'll kick things off by looking at just how common gum disease is. Then we'll dive into how hormones, from your monthly cycle all the way to pregnancy, can affect your mouth. We'll also explore the two-way street between your thyroid and your gums, see how bone loss plays a role, and finally, we'll connect all the dots.
To really get our heads around this mouth-body connection, we have to start with the main issue inside the mouth itself, periodontal disease. And the scale of this problem might surprise you.
Just look at that number, over 1 billion adults. The World Health Organization estimates that's about 19% of all adults on the planet. So this isn't some rare, obscure condition. It's a massive public health issue, which makes its links to other diseases so incredibly important. So what are we actually talking about here? Well, periodontitis isn't just about having sore gums. It's an infectious disease that attacks the very foundation that holds your teeth in your head. It causes inflammation, and this is the crucial part. It leads to the actual breakdown and loss of bone in your jaw. And here's why that's such a big deal. The inflammation and bacteria from your mouth, they don't just stay put. They can get into your bloodstream and travel throughout your body. And we now have solid research confirming strong links between periodontitis and all these serious conditions you see here, from diabetes and heart disease to stroke. Okay, so let's dig into our first specific connection, the powerful influence that hormones, especially female sex hormones, have on your oral health. This is pretty remarkable. Studies show that even if your brushing and flossing habits are perfectly consistent, the hormonal peaks around ovulation and right before your period can trigger what's called an exaggerated gingival response. Basically, your gums can get more inflamed and sensitive, not because you suddenly have more plaque, but because your body's reaction to that plaque is dialed way up by your hormones. Now, this hormonal connection gets even stronger during pregnancy. For the longest time, there was this myth that you should avoid the dentist if you're pregnant. But the American Dental Association and the American College of Obstetricians and Gynecologists are in total agreement on this. Dental care isn't just safe, it is absolutely essential for a healthy pregnancy. During pregnancy, it's common to see more gingivitis for that same reason we just talked about. Hormones are amplifying the body's reaction to bacteria. There's also a higher risk for cavities and acid erosion from things like changes in diet or morning sickness. The bottom line is, staying on top of your dental health during this time is more important than ever. All right, let's move on to another fascinating link, this time involving your thyroid. It turns out the relationship between your thyroid function and your gum health is a two-way street. And this is a really important idea to grasp. An unhealthy thyroid can make gum disease worse. And at the same time, the chronic inflammation from gum disease might actually affect your thyroid. It's a feedback loop that just goes to show how interconnected everything in our body really is. And what's wild is how the different thyroid conditions have their own distinct effects. If you have an overactive thyroid or hyperthyroidism, you're looking at a higher risk of developing periodontitis and deeper pockets around your teeth. On the other side, an underactive thyroid or hypothyroidism can make existing gum disease worse by messing with your mineral balance and slowing down your body's ability to repair itself. And this quote from a recent major review of the research really says it all. The scientists are concluding that getting a patient's thyroid condition under control could actually help their dental treatments work better. It's a huge call for more collaboration between dentists and doctors. So let's widen the lens now to something that can affect your entire skeleton, osteoporosis. It's really the classic example of a systemic disease that has very real effects inside your mouth. Think about it this way. The same process that makes the bones in your hip or your spine more fragile is also happening in your jaw. It's weakening the very bone that your teeth are anchored into. Your jaw is not somehow immune to this process. And hey, this isn't just a theory. Study after study has shown a direct, positive link between low bone density throughout the body and lower bone density in the jaw. And what does that lead to? A much greater risk of losing teeth. Let that one sink in for a second. 3 times more likely. This one stat just drives the point home. Osteoporosis isn't just about worrying about a fall.
It is a direct and significant threat to keeping your teeth for your entire life.
Now, this also brings up a really important point about treatment. A common type of drug used for osteoporosis, called bisphosphonates, are very effective, but they come with a rare but very serious risk of something called bronze. It's a condition where bone tissue in the jaw can actually die, and it often happens after a dental procedure.
So, the key here is being proactive. The expert advice is crystal clear. Before you start these meds, get a full dental checkup. Take care of any cavities or gum disease first. And, if you can, try to avoid major procedures like extractions while you're on the therapy, because that can be a trigger. Okay, so we've looked at hormones, the thyroid, and our bones. Let's pull it all together now and really connect those dots. This chart makes the connection so obvious. When you put the risk factors for osteoporosis and periodontal disease next to each other, the overlap is just undeniable. Things like smoking, getting older, what you eat, they're risk factors for both. These aren't totally separate problems. They're often two different symptoms of the same underlying health challenges. So what's the bottom line here? First, start thinking of your mouth as a mirror for your overall health. Second, know that totally normal hormonal changes can make your gums more vulnerable. Third, remember that two-way street between your thyroid and your gums. Fourth, never forget that healthy bones are the foundation for a healthy mouth. And maybe the most important one, bridge that communication gap. Tell your doctor about your dental health and tell your dentist about your overall health. And that really leaves us with one last question to think about. The next time you sit down in that dental chair, maybe the conversation shouldn't just be about cavities and flossing. Maybe it's time we all started talking to our dentists about our whole body health. Because as we've seen, it's all connected.